Today, I'm talking about one drop that can ruin your perfect 2020 after cataract surgery. This drop is one that could be swapped by your pharmacist even without notifying your doctor. Why does this matter? Because this single swap can lead to many weeks of blurry vision after cataract surgery, and in many cases even cause a permanent damage. Hi, I'm Dr. Cohen, a board-certified cataract and premium lens surgeon. After performing tens of thousands of surgeries over the last 25 years, I've noticed a disturbing pattern. Almost every time a patient walks into my office with blurred vision from swelling after cataract surgery, their drops were switched. In many cases, the patient didn't even notice that the drops were not the ones that I prescribed. By the way, I must say that I have absolutely no financial interest tied to any of these drops. So what is this complication and what is the drop that can cause it? The complication is called cystoid macular edema, or CME. It's caused by tiny leakage of fluid in the center of the retina, the macula. That's the part of your eye responsible for your sharpest vision. When that area swells, your vision becomes hazy, distorted, or faded. The good news is that it's almost completely preventable with the right eye drop. After surgery, you're usually given 3 types of drops: an antibiotic, a steroid, and another type of drop called non-steroidal anti-inflammatory, or in short, an NSAID. What's important is this last type, the NSAID. This is what is given specifically to prevent swelling in the back of the eye. This drop could be either ketorolac, Bromfenac, diclofenac, or your real friend, Bromfenac. You see, Bromfenac has been repeatedly shown in multiple studies to have a superior outcome compared to all the other NSAID drops. But this is not necessarily aligned with the agendas of many insurance companies and pharmacies. It could be lack of coverage, but also sometimes the pharmacies may switch the drops because of profit margins, hoping that they are equivalent. But I can tell you from my experience with tens of thousands of eyes, they are not. Not all NSAIDs work the same. They may sound alike, but their ability to reach and protect the back of the eye is very different. Bromfenac penetrates deeper into the eye and lasts longer than other NSAIDs. Although some forms are meant for once a day, I like to use it twice a day. Think of your eye like a layered onion. To reach the retina, the medicine has to pass through each layer and stay active. Bromfenac's unique chemistry helps it cross those barriers and remain potent. Other drops lose strength before they get there. The first time I tried Bromfenac, the results were striking. Rates of CME dropped to near zero. Not only that, but also every time we did spot a case here and there, it was from a patient who was on something else. So we decided to make sure that all patients got prescriptions from Bromfenac. But that was not enough because some patients couldn't get it covered by their insurance, and yet others would get switched by pharmacists without even calling us. Almost every time I see a case of CME in my office, the drop was substituted. And the patients mostly had no idea. The bottle looked fine, the name sounded close enough, and no one explained the change. Even some doctors aren't aware of this significant difference between Bromfenac and others. They assume all NSAIDs perform similarly, but in real-world outcomes supported by multiple clinical studies, Bromfenac consistently leads to clearer vision and faster recovery. So what should you do? First, check your bottle before leaving the pharmacy. Make sure it says Bromfenac. It may appear under names like Prolensa, Bromcyte, or Bromday. If it says ketorolac, Bromfenac, or diclofenac, ask your pharmacist to contact your doctor. You have the right to receive exactly what your surgeon prescribed. Second, ask your surgeon to write "do not substitute" on the prescription. This prevents automatic replacement. Third, report any blurriness early. If your vision looks foggy 2 or 3 weeks after the surgery, call your doctor. CME can be reversed easily if caught early. And finally, share this information. Many patients and even some doctors still believe all anti-inflammatory drops are interchangeable. They're not. Pharmacies substitute for practical reasons, insurance inventory, or profit. But you only have one pair of eyes. And when it comes to your vision, small differences in medication make big differences in outcomes. Cataract surgery today is safer and more precise than ever, but success doesn't end in the operating room. It depends on what happens afterward, and that includes the drops you use every day. If you'd like to learn more about the different types of cataract surgery, click here.